oftentimes runners come in with medial shin pain, and sometimes that's the early stages of a stress fracture. Sometimes that's just tension in the muscles because either they're being what we call too toey, they're pointing their toe or running on their forefoot instead of the whole foot or midfoot stance during running, or they're just spending too much time on their forefoot, putting a lot of stress into what we call the posterior structures here, the calf and Achilles, as well as some of the muscles on the bottom of the foot. So to loosen up the medial flexors here, what we do is take a proximal tension. We basically find the bone and kind of dive off it like it's a little cliff there. We just kind of come around the corner there and press right on where those muscles start to attach. And we have to get between the bone and the soleus here, the Achilles and soleus, to get right on those muscles. Usually I'll have someone go ahead and point your toes down and then flex your foot in like that and then relax. And then again, please. So good. And that tells me I'm right on the right spot. And then once I find it, then I get in there, take a proximal tension and pull up just like that. Usually it's so tender in there, I'll usually just do a little bit of slow work to kind of ease them in because oftentimes it's just too painful to work. So this is the best way to treat medial shin pain, is when you're in this prone position where we work right in between your tibia and your soleus right there, right in those muscles. It's usually very sensitive. And we take a proximal tension just like that, and we stretch the muscles as we're working on it. That works better because the combination of stretching and deep tissue work tends to relax those tissues and lengthen them faster, brings better blood flow in that area. So if you're having medial shin pain or anything that's irritated along that bone, pay attention to it because that could be the early stages of a stress fracture. It takes a while for that to develop, so just don't ignore it. Take it seriously. If your at-home treatment plan is not working, then come in. We can really help and get you feeling better as soon as possible.